How can PGT prevent genetic diseases during IVF? Imagine being able to choose the healthiest embryos before pregnancy even begins. That's what preimplantation genetic testing can do during in vitro fertilization. When couples undergo IVF, eggs are fertilized with sperm in the lab to create embryos. These embryos are then grown for a few days. During this stage, a tiny sample of cells is taken from each embryo. This process is called embryo biopsy. The cells are sent to a lab for genetic analysis. This testing looks for specific genetic mutations or abnormalities in the chromosomes. It helps identify which embryos carry genetic conditions that could be passed on. There are different types of preimplantation genetic testing. The most common is PGT4 monogenic disorders. This test checks for single-gene diseases like cystic fibrosis or sickle cell anemia. If an embryo has the mutation, it can be excluded from transfer. Another type is PGT4 aneuploidy. This screening finds embryos with abnormal numbers of chromosomes. Conditions like Down syndrome happen when there is an extra chromosome. Choosing embryos with the correct number of chromosomes increases the chances of a healthy pregnancy. There is also PGT4 structural rearrangements. This test looks for chromosome translocations or other structural issues that can cause miscarriage or genetic disorders. Using these tests, doctors can select embryos that are free of specific genetic problems. This reduces the risk of passing on inherited diseases. It also helps avoid difficult decisions about pregnancy termination later on. Couples with a family history of genetic disorders or who are carriers benefit greatly from PGT. It allows them to make informed reproductive choices. Plus, it supports the goal of having a healthy baby. The process of PGT adds a step to IVF, but it's worth it for many families. It improves the chances of a successful pregnancy and healthier baby. It also allows for single embryo transfer, reducing the risk of multiple pregnancies. In short, PGT acts as a safeguard during IVF. It helps identify and exclude embryos with genetic issues before implantation. This way, families can plan with confidence, knowing they are giving their future child the best start possible.